My name is Michelle Conroy, and I am one of the allergists at Mass General, where I treat a variety of allergic conditions, but I actually have a passion for managing food allergies. I see both adults and children with food allergies. And in addition, I also do laboratory research to try and understand both the causes of food allergies and also perhaps some future therapies. When a person comes into the clinic to have a question about the possibility of whether they might be allergic to a food, we follow the same process with every person who comes in with this question. We start with a very detailed history of what happened, both what was eaten, how much was eaten, and then what types of symptoms happened, and maybe even how quickly, and sometimes even what was the treatment of those symptoms, in order that we can fully understand what happened. We then have testing that we do, both skin testing and also sometimes blood testing, that help us understand from more a quantitative or a number standpoint how to characterize the allergy symptoms that may have happened before. And sometimes those tests are very difficult to decipher, and we need additional ways to understand how significant it might be to either reintroduce this food to a person's diet or maybe even introduce it for the first time. While sometimes these tests can be very helpful to understand whether or not there's an allergy to the food present, sometimes they can be difficult to decipher and generally sometimes inconclusive. And because of that, and because of how important it is to answer the question about food allergy and the risk of food reintroduction, we undertake a challenge, or what we refer to as a supervised ingestion challenge in the office, which is exactly what it sounds like, where we literally give the food in question under very close observation and see if that is tolerated or if symptoms occur when the food is ingested. And as I mentioned, this is in a very supervised setting and done in a very kind of practical way, where we start with very tiny amounts of the food. So for something like peanut butter, we would start with this much, so a really small amount. And we increase the amount of the food over time. And what we're monitoring for are symptoms of allergic reactions, or if there aren't any symptoms, then it suggests that the person is tolerant of the food. Sometimes this is really the only true way to fully determine whether or not there indeed is a food allergy present. And the food challenges are conducted the same way, whether it's an adult or a child, whether it's peanut butter or milk or shellfish. It consists of a team of allergy practitioners who do this every day. There'll be a nurse practitioner, and an allergist who all work together with the patient, and in some cases the family, if a child is involved, to administer this supervised challenge. The challenge always starts by describing the testing that was already done and why the challenge is necessary. So explaining perhaps why there's some maybe discrepancy between the skin and the blood test, or why generally things are inconclusive. And I will say that usually the decision to pursue a food challenge only happens if there's a 50% chance or likelihood of passing, which is to say that most people will pass food challenges, but some don't. So the procedure starts by explaining the procedure itself, leaving time for questions, and actually getting what's called a consent form signed, where we discuss the procedure itself, the benefits of the procedure, so why is this a good thing to be doing, and also the risks that are involved in the procedure. And then we always give plenty of time for questions before the procedure starts. So this is an opportunity to ask what might happen, to express any concerns or anxieties, or to even let us know something particular about you or your child that are important to know before we start the challenge. Then we actually move into the challenge itself. And the challenge structure is basically the same for the foods that are for all foods tested. Generally speaking, we choose a goal dose, so the amount that you will ingest through the course of the challenge, which is based on the food itself. So for example, for peanut butter, we'll have 2 full tablespoons for an adult will be your goal dose. And in the case of a child, it would basically be 2 teaspoons, so 2 of these. So that's the total amount that you need to ingest without symptoms to be able to say that you are not allergic to that food. And so that's where we start. And basically what happens is we take that goal dose and we divide it into a number of steps. And we start with really tiny amounts of the food, like I mentioned before, in the case of peanut butter, starting with this much of the food, tiny, tiny amount. And then there are either 5 or 6 steps, depending on sometimes the food, sometimes the age of the patient, sometimes the discretion of the allergist. And we increase the amount at each step by 2 or 3 times what you received in the prior step. And then we move through the course of the challenge, and over 5 to 6 steps, we get to that goal dose that we talked about at the beginning of the challenge. There are 15 minutes between each steps, and it's important to know that at each of those steps, there is an assessment. So the team comes in to look for things like rashes or new complaints that maybe weren't there to start with, so new symptoms. And then there's also vital signs taken so heart rate, blood pressure, and oxygen levels at each of those steps to be sure that there's no changes from what started at the baseline. The whole procedure takes somewhere between 2 to 4 hours, I would say, depending on the food and often depending on the age of the patient. So sometimes the pediatric populations take a little bit longer to get through the challenge. And then it's important to know that once the challenge is finished, there will be instructions whether the challenge was passed or not. Which brings me to probably what everybody wants to know about is what is the risk of reactions in the context of food challenges and what happens when that occurs. So as I mentioned before, we don't usually recommend challenges unless there's better than a 50% chance of passing. So you're already sort of 50% likely to pass or not. And I would say that part of the reason why we start with very tiny doses of the food or very small amounts of the food is because the first steps might bring out very minor symptoms that can be treated with typical allergy medications like Zyrtec or Allegra or Benadryl. And that's sort of it, that would be the challenge was not passed, that you are clearly allergic to that food, and then we monitor you for an hour or so after that occurs. But it certainly is true that sometimes the reactions can be more severe and more significant symptoms occur. So for example, there might be hives or swelling or vomiting or wheezing, similar to maybe even what the original reaction was. And in those cases, there needs to be more significant intervention, such as using an EpiPen or some other injected medications. Regardless of the severity of the reaction, we monitor people for a sufficient amount of time to be sure that not only have the symptoms resolved, but that they also are very unlikely to come back. In the conclusion of any challenge, whether the food has passed or not, whether there's evidence that you are allergic or not, we will give instructions for how to proceed from here. In some situations, that will be how do you continue to restrict this food from your diet? And in other situations, it might be, how do I introduce this food to the diet? How much do I need to eat? And how frequently do I need to eat it? And in either case, you will leave the challenge with a very clear plan of how to move forward with regard to the specific food that was tested. It's important to know that food ingestion challenges are conducted in allergy offices across the world. They are safe, structured procedures that are based on really a lot of data and prior clinical trials. So for example, the structure that we use in our food ingestion challenges, whether it's for a 1-year-old or a 51-year-old, are the same that were done based on all of the studies to help us understand the best way to administer these types of tests. So this is not something that we do much differently from any allergist across the country. And really, most people pass challenges, and this can be a life-changing thing, both to understand food allergy, to help mitigate anxiety around food allergies, and to not unnecessarily avoid food allergies. And I'll say one other thing, in particular in the pediatric population. One way that we use food challenges is we know now that early introduction of foods is critical to avoid development of food allergy. And sometimes we have a really small window of time that we can introduce a food and prevent the development of food allergy. And we use food challenges a lot in that context, even challenging children under the age of 1 year to prevent food allergy. So this is a procedure that we use frequently, and I would encourage anyone who is scheduled to have a food challenge to talk with their allergist, make sure the questions are answered, and we look forward to working with you in the future and helping you to understand what your reaction may have meant or the reaction that your child had, and or to introduce foods into the diet to prevent food allergies. Thank you so much, and we look forward to seeing you in clinic.